Hi, my name is Taylor, and today we're doing a bedside swallow evaluation. This includes an oral mechanism exam as well as food trials. Today my client is Grant. Before I met with Grant today, I reviewed his charts. This means I looked over any previous medical history, his diagnosis, why he was referred to a speech pathologist, and also any concerns the patient might have. When I entered the room, I introduced myself to Grant, and I observed that Grant was sitting at a 90-degree angle, which is a proper position for swallowing. I also noticed that Grant was alert and engaged with conversation with me. Another thing I noted was that Grant was not anteriorly losing any of his secretions. Next, I checked on Grant's breathing. Grant is not breathing quickly, there is no signs of distress, and Grant is breathing through his nose properly. Grant, I would like you to hold your breath. Good, now blow out. Good. Grant is also able to hold his breath. Okay, Grant. Today we're going to be doing an oral mechanism exam. This means I'm going to be looking at the parts of your mouth and throat that are included in a safe swallow.
Sounds good.
So first, I'm going to be looking at Grant's neck area. I noticed there's no scarring or any other things that should be noted for a safe swallow. Okay, Grant, I'm going to stick the tongue depressor on your tongue. First, I noticed that Grant's teeth are all in a good condition for chewing and swallowing. I noticed Grant's tongue, his false pillars, his uvula, as well as both of his buccal areas. Good. Next, Grant, I'm going to ask you to move some parts that we use for swallowing. First, we're going to start with your jaw. Can you move your jaw side to side for me? Good. Now put your jaw out kind of like this. Good. Now put it back. Alright. I would like you to push down and open your mouth. Good. Now, let's open it one more time. Now close it, please. Thank you. Next, we're going to be working with your lips. Push your lips out like a kissing face. Next, smile. Next, I want you to seal your lips. So we're going to do this by puffing up our cheeks, and if you can hold the air, right, like that. That means you can seal your lips. Next, I'm going to stick the tongue depressor on one side of your mouth, and I'm going to put it between just your lips, not your teeth. I just want you to hold the tongue depressor there. Good. I'm going to pull on it. You just hold on to it. Good. Okay, you can let go. Now I'm going to do the other side. Close. Just lips. Good. Thank you. You can let go. This demonstrates that the client has good lip seal and closure because they are able to hold on to the tongue depressor without letting go. Grant, next we're gonna move our tongue. So tongue out, all the way out. Good. Now back in your mouth as far as you can go. Good. Now I want your tongue out and you move it side to side. Good. Now I want you to put your tongue over in the side of your cheek. Good. And over here. Good. Okay. Now I want you to clean the top of your mouth with your tongue like if you had peanut butter stuck up there. Good. And then rub it along the bottom of your mouth. Good. Okay, next, Grant, I'm going to have you make a few sounds. First, we're going to start with the puh sound. I want you to make these sounds as fast and steady as possible. It would sound like puh, 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 puh. Your turn.
Puh, 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 puh.
Good job. Next, we're going to do tuh. So tuh, 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 tuh.
Tuh, 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 tuh.
Good. And next, we're going to do cuh. So cuh, 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 cuh.
Cuh, 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 cuh.
Alright, we're going to put them all together this time. We're going to go puttica, puttica, puttica. Keep going until I tell you to stop.
Puttica, puttica, puttica.
As fast as you can.
Puttica, 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 puttica.
Good, thank you. Alright. Next, I'm going to stick the tongue depressor back on your tongue, and I'm going to have you say ah.
Ah.
now I'm gonna push the tongue depressor and slowly back it up on your tongue. Good. Alright, now I'm going to touch the tongue depressor to different sides of your tongue, and I just want you to raise the hand on the side that I'm at. So if I touch the right side of your tongue, raise your right hand.
Okay.
Good. Good. Okay. Now I'm going to touch your tongue, and you tell me if I'm touching the top, the front, or the back.
Okay.
Okay?
Fine.
Good. Alright. Next, Grant, I'm going to ask you to take a big deep breath in, and as you blow out, say ah as long as possible. I'm going to count. Okay? Good. Alright, next I want you to repeat what I do. First we're going to raise our pitch. Ah. Alright, next we're going to lower our pitch. So, ah. Good. Next I'm going to have you just cough. Alright, next I'm going to have you clear your throat. Good. Alright, next I'm going to put my gloved hand on your throat and I'm going to feel your larynx, which raises when you swallow. Alright, and swallow. Good. Alright, next, Grant, we're going to do our food trials. First, we're going to start with water. After each one, I'm going to have you say ah. When I give it to you, I'm also going to have my hand here so I can feel your swallow.
Ah.
Good. Alright, a little more.
Ah.
Good. Now I'm going to let you take a sip out of the cup.
Ah.
Good. Now you can take a few sips. Good.
Ah.
I'm going to have you hold the cup and just take whatever a normal sip would be for you.
Ah.
Good. Alright, now we're going to use the straw.
Ah.
Good. Now I'm going to let you take a normal drink out of a straw.
Ah.
Good. Alright, next we're going to do some applesauce. This time I don't need you to say ah. Instead, I'm going to shine the light in your mouth and we're just going to check and see if you swallowed it all. Alright. I'm going to use the tongue depressor. Okay. A little more applesauce. Good. All right, now I'm gonna let you give yourself some of the applesauce, whatever would be a normal. The clinician did note that the client swallowed twice that time. Okay, next we're gonna do the cracker. There's minor lingual residue from the cracker. All right, another bite of cracker. All right, I'm gonna let you swallow again or take a drink of water to clear your mouth. All right, this one you can eat however you would normally, whatever a normal bite would be.
Or do I eat both?
No, you can put the rest down. All right, I'm gonna let you take another drink of water to clear your mouth out. Okay, next we're gonna do a chocolate chip cookie. Is that okay?
Yep.
Okay. The clinician is noting normal oral prep time. Now I'm gonna let you take a bite of the cookie however you normally would. Put it back down for me. All right, you can take a drink of water. And that's all I have for you today. Thank you.
You're welcome.
All additional commentary in the form of barks was provided by Miss Ella. Isn't that right? Do you want to eat a cracker?